A well-crafted research question is the cornerstone of any research endeavor, providing direction and purpose to the entire process. A good research question not only identifies the problem to be investigated, but also lays the groundwork for the methodology and hypothesis formulation. In the realms of social and health research, where the pursuit of systematic knowledge is essential for improving and safeguarding the well-being of individuals and populations, formulating a meaningful research question is of paramount importance. This essay delves into the art of crafting a research question, drawing upon a comprehensive set of principles and guidelines. Characteristics of a good research question. Before going into the process of formulating a research question, it is essential to understand the characteristics that make a question good. A well-constructed research question should be 1. Feasible. The research should be realistic in terms of available resources, including time, funding, access to subjects, and data collection methods. Unrealistic research questions can lead to project failure. 2. Interesting. The research question should be genuinely intriguing to the researcher and grounded in academic and intellectual discourse. A genuine interest in the question will serve as a motivating force throughout the research process. 3. Novel. A good research question should not merely replicate existing research, but should aim to contribute new insights, confirm or challenge established findings, or explore uncharted territories. 4. Ethical. Ethics should be a paramount concern. Obtaining appropriate approvals and ensuring the safety and privacy of research participants are fundamental. 5. Relevant. The research question should address issues of academic and intellectual significance within the chosen field, arising from the current literature or practical applications. 6. Manageable. The research question should be manageable within the researcher's capabilities and available resources, avoiding overly ambitious or unrealistic expectations. 7. Appropriate. The research question should logically and scientifically fit the context of the community and institution. 8. Potential value and publishability. The research should hold the potential to make a significant impact in clinical or community practices. It should address topics with clear implications for resolving important issues within the field. 9. Systematic. The research should be structured with specific steps and follow well-defined rules, even though it allows for creative thinking. Example of a well-formulated research question. Would the topical skin application of oil as a skin barrier reduce hypothermia in preterm infants? Types of research questions. Research questions can take on different formats depending on the aspect to be explored, including 1. Existence. Investigating the existence of a particular phenomenon or ruling out alternative explanations. 2. Description and classification. Describing unique characteristics and types of a subject. 3. Composition. Breaking down a whole into its components. 4. Relationship. Evaluating relationships between variables. 5. Descriptive-comparative. Ensuring similarity between groups except for the issue in question. 6. Causality. Examining cause and effect relationships. 7. Causality-comparative. Comparing the effects of two rival treatments. 8. Causality-comparative interactions. Investigating interactions between variables under different conditions. Let's look at some examples. 1. Existence. Can humans detect pheromones unconsciously? Is there scientific evidence for the existence of parallel universes? 2. Description and classification. What are the common characteristics of effective leaders in the business world? How can we classify different types of renewable energy sources based on their efficiency and environmental impact? 3. Composition. What are the main components of air pollution in urban areas? What are the key factors contributing to employee job satisfaction in the tech industry? 4. Relationship. Is there a correlation between a person's level of education and their income? What is the relationship between social media usage and feelings of loneliness among young adults? 5. Descriptive-comparative. Are the academic performance levels of students who receive extra tutoring significantly different from those who do not? How does the effectiveness of two different marketing strategies compare in terms of customer conversion rates? 6. Causality. Does regular exercise reduce the risk of heart disease? Is there a causal relationship between smoking and lung cancer? 7. Causality-comparative. Does cognitive behavioral therapy, CBT, result in better outcomes for treating anxiety disorders compared to medication alone? Is there a significant difference in patient recovery rates between two different surgical techniques for knee replacement? 8. Causality-comparative interactions. Does a combination of therapy and medication result in better outcomes for treating depression in individuals with a family history of the condition compared to those without such a history? How does the effectiveness of two different teaching methods vary based on the socioeconomic status of the students? These examples illustrate how research questions can take various forms, depending on the type of investigation and the relationships being explored. Each type of research question serves a unique purpose in advancing knowledge within its respective field. Developing a research question. To craft a meaningful research question, follow these steps. 1. Start with a broader subject of interest that is amenable to investigation. 2. Conduct preliminary research to identify existing literature and information gaps. Know what is already known and what needs further exploration. 3. Identify implied questions based on the need for more information. Each general question should lead to more specific questions. 4. Narrow the scope and focus of your research to make it manageable. 5. Evaluate the question by ensuring it is clear, focused, not too broad, and relevant to your field. 6. Assess whether the question is researchable within the given time frame and with available resources. 7. Consider the implications of your research and how it can fill gaps in knowledge and have practical applications. 8. Develop a hypothesis, H's, based on your research question. The hypothesis is a predictive statement about the research outcome and guides the research method and design. Going beyond formulation of research question. Once a research question is formulated, it can be transformed into an operational hypothesis. A strong hypothesis should 1. Provide insight into the research question. 2. Be testable and measurable through proposed experiments. 3. Have a logical basis. 4. Follow the most likely outcome, rather than exceptional outcomes. Let's now see how we can go from research question to formulating hypothesis with two examples. 1. Research question. Does a reduced gap between the two segments of the esophagus in patients with esophageal atresia reduce mortality and morbidity? Hypothesis. A reduced gap of less than 2 centimeters between the two segments of the esophagus, with proper mobilization of the proximal pouch, reduces the morbidity and mortality in pediatric patients with esophageal atresia. 2. Research question. Does the application of mitomycin C improve outcomes in patients with corrosive esophageal strictures? Hypothesis. In patients aged 2 to 9 years with corrosive esophageal strictures, applying mitomycin C in a dosage of 0.4 mg/ml for 5 minutes over 6 months improves outcomes in terms of symptomatic and radiological relief. Research question and study design. The transition from a research question to a study design is a critical step in the research process, as it determines how you will collect and analyze data to answer your research question effectively. Here's a step-by-step elaboration on how this process works. 1. Formulating the research question. Start with a clear and concise research question that defines the problem you want to investigate. Ensure your question is specific, focused, and researchable. 2. Choosing a study design. The choice of study design depends on the nature of your research question and the type of data you need. Common study designs include observational and experimental approaches. 3. Observational study designs. Cross-sectional study. This design involves collecting data from a population at a single point in time. It's useful for understanding the prevalence of a condition or the relationship between variables at a specific moment. Example, research question, what is the current prevalence of smoking among teenagers in our city? Study design, cross-sectional survey where data is collected at one point in time. Case control study. Case control studies are retrospective, comparing individuals with a specific outcome, cases, to those without the outcome, controls, to identify potential risk factors. Example, Research question: what are the risk factors associated with lung cancer? Study design: case control study comparing lung cancer patients, cases, to individuals without lung cancer, controls. Cohort study: cohort studies are prospective, following a group of individuals over time to assess the development of a specific outcome and potential risk factors. Example: research question: a regular exercise reduce the risk of heart disease. Study design: a cohort of individuals is followed over several years, collecting data on exercise habits and heart disease incidence. 4. Experimental study designs. Randomized controlled trial, RCT. RCTs involve randomly assigning participants to either a treatment group or a control group to test the effects of an intervention or treatment. Example: research question: does a new drug reduce blood pressure in hypertensive patients? Study design: participants are randomly assigned to receive the new drug, treatment group, or a placebo, control group, and their blood pressure is measured over a specified period. Quasi-experimental study. In cases where true randomization is not possible, quasi-experimental designs are used to compare groups that naturally differ in exposure to an intervention. Example: research question: does a school-based nutrition program lead to better dietary habits in children? Study design: schools with the nutrition program, intervention group, are compared to schools without the program, control group, and dietary habits are assessed. 5. Sample size and data collection. Once you have determined your study design, calculate the required sample size to ensure statistical significance. This involves estimating the number of participants or data points needed to detect meaningful results. 6. Ethical considerations. Ensure that your study design aligns with ethical guidelines, including obtaining informed consent from participants, protecting their privacy, and minimizing potential harm or risks. 7. Data collection and analysis. Implement the data collection methods and analytical techniques that align with your study design. Collect relevant data, analyze it using appropriate statistical methods, and draw conclusions based on the results. 8. Interpretation and conclusions. Interpret the study's findings in the context of your research question. Determine whether the results support or refute your hypothesis or research question. 9. Reporting and publication. Present your study's methodology, results, and conclusions in a research paper. Ensure that your study design is clearly described, allowing other researchers to replicate or build upon your work. 10. Iterative process. Remember that research is often an iterative process. If your initial study design does not yield conclusive results, consider refining your research question and design for future investigations. The journey from a research question to a study design involves careful planning, ethical considerations, data collection, and analysis. The choice of study design should align with the nature of the research question and the type of evidence you seek to gather. Additionally, maintaining transparency and adhering to best practices in research methodology is essential to producing valuable and credible research outcomes.